In that case, I'm just gonna start presenting. Do a couple of introductions really quick. First, I wanted to introduce Representative Chris Campbell, who's here with us tonight. She serves the 26th district in the Indiana House of Representatives. Special thanks to her for being with us today. Of course, this is an event that's sponsored by Greater Lafayette Indivisible. We're a progressive activist organization from Tippecanoe County, Indiana. You can find out more about us on our website. And of course, I'm Chris, Chris Hegarty. I've been organizing in this context since 2017. So I just wanted to go really quick into where we are right now, right? So the regular legislative session ended in late April. The legislators came back for one day in May to override vetoes, and the General Assembly will be back in session later to consider redistricting, right? All right, so I just kind of wanted to open this up, particularly like right now. We have more material on some bills that we were agitating around this session, but I really wanted to make some space for Chris to discuss, her perspectives on issues before the General Assembly this session. So, um, Chris, I'm gonna stop screen sharing, and you're welcome to share whatever you have for us.
Okay, well, I wasn't quite sure based on the message if you wanted me to go over the bills that you had sent or if you wanted me to go over other information.
Right.
Because
Yeah,
I
I think like
kind of, oh, go ahead.
Oh, sorry. The bills that we were talking about, yeah, those are kind of the 6 bills that we had done advocacy around.
Okay,
But you're more than welcome to talk about those or any bills that you found particularly pressing or interesting or that needed
okay.
highlighting toward the end of the session.
I guess I probably should have talked to you ahead of time because I thought maybe you
That's
wanted
all
me to
right.
focus on those bills. So I kind of wrote some notes on those.
Oh yeah, absolutely. That would be great.
Okay, all right. Um, okay, so I realized that there were a few bills that the Indivisible focused on. And they were, first of all, 1577, which was a pretty controversial bill. I know that every year the legislation, there's a few people that really want to make sure that they do everything that they can to make abortions as difficult as they can and coming up with new ways to create obstacles, and 1577 proved to be another one of um, those obstacles that they created. Um, the bill uh, talks about the day after pill, basically. It even names the specific medication bill or a chemical abortion medication in the bill, which I'm not sure if there's any legislation that is so specific about legislation that they're naming specifics to that degree. I think when you are naming a specific drug, you're really targeting a very specific issue. So it talks about the chemical abortion or the 2-pill, and I can't remember offhand what it's called. It wasn't in the paperwork that I took notes on, but it said that it can't be used after 8 weeks of the infertilization, not just 8 weeks pregnant, but 8 weeks post fertilization, which is usually maybe about the time a woman realizes she's pregnant, but maybe not even. So that throws an obstacle in there right away. It removes guidelines from the provisions concerning manufacturer instructions for the patient and patient agreements forms from pertaining to the abortion drug. It requires that the provider give information that has not been FDA approved, which they're forced to tell the patient that after taking the first pill that the abortion may be reversed. There is medication that has been used in pregnancies that slows down a person who may be miscarrying. And there is some thought that could be used to reverse the effects of the this chemical abortion after the first pill. There have been cases where they did attempt this and it caused hemorrhaging in the patient. So the fact that it's not been an FDA approved procedure, and that they're requiring the provider to give this information to a patient, it creates a lot of pause when it comes to legislating a medical procedure. It also requires that they do an ultrasound of the fetus, and that they provide a copy of a printed copy of the pregnant woman and force the woman to take it at no charge to the patient, and that they maintain a copy of the fetus ultrasound photograph. It also requires that not only that the patient receive parental consent for an unemancipated pregnant woman that is less than 18 years old, and that it be notarized. I assume that there could be a notary available at the pregnancy or the care location. But the fact that they're requiring a notary, even in a medical facility, I would think that there's you'd be facing some HIPAA violations there. And it also prohibits the use of telemedicine to provide even the chemical abortion or writing of a prescription. In the fiscal for this bill, it does automatically include the costs for cases, because it's just assumed that, you know, this case will be brought to court because of some of the provisions in here that will probably face a lawsuit. The legal costs for a case in 2013 was $170,000, and in 2015 was $122,000. So it's interesting that we had to beg for extra money for things like, you know, increasing the food banks, which have been at $300,000 for years. We finally did get more money, which is good, but you know, I just there's a lot of times bills will stop just with a fiscal like that. And this is, you know, we have brought up in prior years when they're passing this sort of legislation that this will trigger a lawsuit, which will be overturned as unconstitutional and cost taxpayers money. But the testimony of Representative Mayfield was that, you know, she really felt like the things like the ultrasound were so important because, you know, seeing the fetus may cause the person to change an opinion, but obviously a lot of it is punitive. The next bill that, and please ask any questions and please interrupt me if there's any questions in the chat or anything that you want to ask in the meantime about some of the bills that I'm going over. What's that?
On a bill like that, is it something, you know, we read about ALEC where they're kind of copying the legislature from state to state. Is that something that was copied from another state, or is this something our own wonderful legislators made up on their own?
I'm sure that they got it, because she did mention that in testimony that when that the pregnant woman sees the fetus or hears the heartbeat, that has been an important thing that has made them change their mind. Although, you know, there's obviously, you know, with telemedicine was a big topic this year. I believe that, I thought that this may have been, they may have included it in the telemedicine bill anyway, that they couldn't do any of this through telemedicine. But, you know, it just seems like any opportunity that they can in any health related things, it's the topic just comes up, and we'll go over a little bit later. I know that one of the questions was on Senate Bill 51, where it you take an unrelated topic where it's obviously not important to put abortion language in, but that I don't know, there's just this thought, just to be safe, let's, while you're building a house, don't have an abortion or provide, contraceptives. It's like I don't know how this is important, but it seems to be coming out. And I think that to me, it's very frustrating because I think that, things should be written a little bit better in our Indiana code, and things are pretty messy. If you really start digging into our Indiana code, a lot of unrelated things are put in there. I know that the wetlands bill was a pretty important bill, very concerning, that they wanted to remove protections of wetlands. This was a builder's bill. In spite of any other testimony that you hear, I got a newspaper from the Builders Association. They were very happy that this bill went through. It was a very important bill for them. They want to be able to reduce cost as much as they can to build new houses. There's a huge housing shortage in the state. They will also say, in many of the builders' bills that they're trying to build affordable housing, but they never allow anything in their code that says that they need to use this to build at least a certain percentage of affordable housing. But obviously the wetlands bill had more to do with making properties more available and reducing the cost of making sure that they have to mitigate the property before using the property to build houses on. So they changed the classifications of class 1 and class 2 wetlands. They removed the requirement that they have to have a permit on a class 1 wetland, and that they can also do class 2 wetlands if it's not more than 3/8 of an acre. And that's in a rural or municipality. Class 3 wetlands still remains the same. I'm not as familiar with how class 1, class 2, class 3 wetlands were defined prior to this legislation, other than it became much easier for them to work on the property and not provide the mitigation for the property that you would normally have to do to make sure that there would not be any contamination to waters, aquifers, or anything else. So it will make property more available. It also includes agriculture land that if it has been used for agricultural purposes, that it wouldn't have to go through the same sort of permitting process that it had prior. They did try to change it in the House that made it a little better, defining the wetlands as in the class 1, 2, and 3. It had to do with changing the definitions to accumulation of water of an inch. So again, this is not an area that I'm an expert in. I know that it still was not a great bill, but it made it a little bit better. But once it went back to the Senate, they ripped out all the changes and went back to the original bill. That's something that we saw pretty frequently this year. If bills went through and there were changes made in the House, by the time it returned back to the Senate, they dissented and they returned the bill to the original bill, and then they went through. So in this case, this went through. I know that we had a lot of groups and including legislators that had a letter to the governor asking that they veto that bill, but that was obviously didn't occur, and they did pass that through. I know it also affected the sections of the Clean Water Act. It didn't affect Section 404, but it did affect Section 401. Which gave states the and authorized tribes the authority to grant, deny, or waive certification of proposed federal license or permits that discharge into waters of the United States. So I believe that it does affect it because it amends the law. That I think it had to do with the material that they could use to fill, to use for mitigation, but I'm not positive on that. So either way, it's a bad bill. It was a builder's bill, and it removes protections for the remaining significant portion of that 15% of the remaining wetlands that have not been affected in the state. Another bill that came up was House Bill 1005, and that has to do with an Indiana education scholarship account, which allows a student with a disability, a student with a parent who's on active duty of the armed forces, or a student placed in foster care or otherwise care or supervision of the Department of Child Services. So their caregiver will receive basically an app on their phone that will have money in it. Basically the money that would go to education. It was between $6,000 to $9,000 could be in this account for the caregiver to be able to use to pay for school or any school related charges that they have. It also changed the eligibility for who would be eligible for the school choice scholarships. So when the school choice scholarships started, they were completely based on people that were living below the poverty level, and was sold as basically a way to help children in failing schools, or or areas where they may want to get out of that school system for other opportunities. It has continually gone up. The most recent was definitely twice the poverty level at basically your average income level. You could get up to half of a scholarship. In the past year, the latest legislation that was passed is now at twice the average income of a person in our families in Indiana. $144,000 a year for a family of four can receive 90% of a scholarship and be able to use that to go to any private school of their choice. So there's some real concerns about, especially this this app, which is going to be managed by the state, the Treasury of the state, where they're going to be administrating this program. It's a new program where you're going to have people that where there's not going to be a whole lot of oversight. They're going to have access to this money. And they can buy books, which are not provided for in our public schools. They can buy uniforms. Obviously, clothes are not provided for students in our public schools. So it really expands what they can do with the money that, our average public school students won't be able to receive any sort of tax dollars for. I know that the budget did increase $1.9 billion into our education for the next 2 years, which is amazing that, we're very happy that they were put that much money into the budget. We have to really keep in mind, though, the reason there's so much money to put into the budget is because the state is getting a lot of federal dollars. So this is the money that is being put into the education system will not be completely just from revenue. So my concern is in 2 years when they say, well, now we're back to regular revenues, are they going to make cuts to our public schools and still maintain this full coverage for private school? If we're going to be funding private schools basically to 90%, covering their cost, that seems like quite a big increase. So very concerned about that. I did also notice that we also have to keep in mind that for 1005, it didn't technically die. It just got moved. They actually put it into the budget. So it didn't have to pass because it just became a permanent part of the budget. So it is part of the budget formula for education. So it's completely embedded into the future of our education system that we're going to be funding private schools. What was I going to say? Okay, so one of the things to keep in mind is that when our public schools are funded, it's based on the student and the school and the area, and there's this formula that they've created to figure out how much to pay for each student. So each student is funded based on this formula per student per school. So if you're in a school that is losing enrollment, the amount of money your school is going to get is lower. Most of the formula, though, they say they're going to give you, they say $1.9 billion, but they're also saying that almost every school in the state is gaining students. So if your student doesn't get that money, the money that would have technically, has been estimated will go to that school actually will stay in the general budget. So that $1.9 billion isn't actually going to go to the school until, they have accounted for all those students. I also noticed that when the formula runs were first done at the beginning of the year, they said just almost all the schools in our district, our area, West Lafayette, Tippecanoe County, and Jefferson, the Lafayette school system, we're all going to get 150 students a year. That seems very specific considering, I'm sure that Tippecanoe County schools are growing, there's so much building going out in the county that they're going to have definitely more than 150 students. But, West Lafayette schools are basically at capacity, really, may not even have room for an extra 150 students. And Lafayette Jefferson schools, Lafayette School Corporation may even be losing population or maintaining population. So like I said, the numbers are all estimates and make it look a little more inflated because like West Lafayette schools. Oh, and then when the final formula runs went, they had all the schools getting 200 students for the first year and maybe like 50 students for the second year. It's like, what's changed here? Why are all these schools suddenly getting 200 students and 50 next year? it makes it look like the school's getting a lot of money, so they obviously can give all the teachers raises, but they can't give the teachers raises if they needed those 200 students to actually get to the point where they could afford it. And if you have 200 more students, you're probably going to need a lot more teachers. So also something to keep in mind. But I am optimistic that the schools are getting well funded next year. But we also have to keep in mind, we're trying to get the teachers up to $40,000 minimum, baseline starting incomes. And we're comparing the incomes to states around us because that's about where they are. Those states are probably also going to be getting a lot of federal dollars. So I wonder if those states are actually going to go up in incomes. Please stop me anytime and ask questions. I know I can ramble. So
No, thank you. I just had one minor question because,
yeah,
and it's sort of something that I've heard a lot because, when we're talking a lot of times to legislators or to people around educational policy, which, as you said, there's a funding formula, it's somewhat complex. One thing that I've heard, particularly from Ways and Means and Tim Brown, is that the state can't control that. Like the state has nothing to do with that. The state can't decide. And I
we're
was just
not.
wanted your take on that.
Oh, I love their wording. Yes, we gave them the money. It's up to them to give teachers raises. We provide the money. And yeah, they're always shoving it down to the local level. It's like, well, if you give them the amount of money that doesn't even keep up with inflation, how are they going to have enough money to give raises? And they just like to avoid that topic. And I'm sure, again, we talk about ALEC, I'm sure there's some talking points there that they're, because it's very repetitive. They use the same, all of them are using the same arguments for a lot of this. I know that, one of the big talking points this year, which was really annoying, was, in 2009, I believe, $300 million was cut out of the education budget. And every year that was never replaced. So, even though it was not keeping up with inflation, they said, well, obviously we've given you more than $300 million from since then. Stop complaining about it. It's like, no, you haven't replaced the $300 million. Just, you can't say, well, we gave you a 1% increase and that had $300 million in it, which, obviously is not the case. So yeah, you have to really take into account what they're saying, they just have certain talking points that they will continue to use, and for the average person that isn't aware of the specifics, that sounds pretty good. Yes, it's up to the schools to give the raises. We're not in the business. We set the budget. It's not our fault they didn't use the money to give raises. But obviously it is our fault if we're not giving the schools enough to pay their bills. And the fact that, we have a lot of old school buildings out there that need repairs, and, yeah. So obviously there's a lot of issues with that. So one of the next bills that you had on your list was Senate Bill 51, which actually got put into a bill that I was on, which was House Bill 1405. The reason this bill came up, the bill originally was about Medicaid and getting Medicaid reimbursement for students for their individual education plans and their 504 plans for special needs students, and making sure that they get the services they need. It also added physical therapy so that they could receive physical therapy reimbursement through Medicaid. It also changed it so that the school psychologists could make the referrals. One of the issues that's happening is that the requirement to get Medicaid reimbursement has to come from their medical provider, and getting a patient or a child that's on Medicaid, their doctor's appointments, and then getting the doctor to make the referrals so that they can get the reimbursement was becoming a real challenge. So the main goal of this bill was to make sure that the kids could get their IEPs met, reimbursement to the schools for Medicaid, and it was to offset costs in the schools, because it was also, if they got Medicaid reimbursement, they were going to also offset that cost with how much the school got, because they figure, well, if you got paid, then we don't need to pay you. So, and this goes back to the next section. Like I was saying, while you're building a house or building a road, make sure you don't have an abortion. You know, they had to put some abortion language in here. I was very upset that they put it in there, especially when they moved it into the bill that I was on. I had everybody look at this language, and the school psychologist is not going to be making referrals for abortions or contraceptives. So I'm fairly assured that this is useless language, and it's just taking up space, and is pretty ineffective. But the fact that they felt the need to just throw that in, plus the fact that Medicaid doesn't cover abortions, and Susan, I see you here, so you can jump in at any point and clarify anything that, if I'm wrong, you know. I know Susan is one of the people that I called about this bill, and you know, asked, you know, is this going to prevent a student from getting the medical services they need, or contraceptives, or abortions, or anything? And I mean, we kind of came to the conclusion that it's not likely to be useful language. So, you know, so we're good on that.
I had one question. I threw it in the chat, but it applies here too. I couldn't remember in the assembly, how many other, or are there other clinical providers besides you at this point?
Clinical providers
of any type of, you know,
oh yeah,
audiology, I mean, like, or even health system, whatever.
Well, we have Rita Fleming, who actually is a Democrat and pro-life, and she supports, you know, any abortion language, which really is disturbing, including the telehealth bill that the 1577, I believe she supported. So that's concerning, but she is an obstetrician. She does testify against things to tell people why, you know, it's not a good idea. But I think for her community, she feels that she needs to vote pro-life. Mm-hmm. So, but let's see, who else? Well, we have a Dr. Barrett, who is a Republican, who's the head of, he's a surgeon. He's the head of public health now. We have a pharmacist, Davison. I'm probably forgetting people, but yeah, there are. We have Dr. Zent, who's a former dentist. So there are medical providers that are there. Yeah.
Surgeons in charge of public health is not my favorite thing.
Well, yeah, I was hopeful that he would be more supportive of my cytomegalovirus bill, which I actually gave to him. So he was the author, and he wouldn't hear it. It's like, come on, because it wasn't. You know, they take their you know, walking papers from, that's not the right thing, but they get told basically, you know, what to hear, what not to hear. And it's frustrating that, you know, there's, you know, we have really good legislation, and, you know, they're putting terrible legislation in. So, all right. So I'm going to go back to the Senate Bill 353, which actually did die, but it was one of the bills that was on your list of bills. And that had to do with requiring a driver's license number or social security numbers before a individual can access their application in an electronic format. I know when they put together the online way to get to your apps to file for an absentee ballot and monitor that was great. I thought it was great that we were able to be able to get that information electronically and be able to file your absentee ballot and everything electronically. You know, so there were some great things that came out of COVID. Of course, there was a lot of concern about fraud. I mean, it's just, I was very frustrated. I got a lot of comments back on my surveys about voter fraud, because I even had a question on should we expand absentee ballots in Indiana, which I know in other states, there have been lawsuits on absentee ballot requirements that are similar to ours, because by having a list of qualifications, you're not offering equal access. So I think there's some issues there. But so anyway, so this was requiring the social security number or driver's license number, but the bill did end up dying. So, but I know we had, I didn't really look at the other legislation that went through. You know, I'm on government and regulatory reform, I'm on insurance, and I'm on ways and means. And just keeping up with those bills and trying to understand them, and things are moving really quickly. It's really hard to follow all the bills in the other committees. So we rely very heavily on our caucus members to inform us in caucus what is on the bill, and really highlight those issues that are controversial, so that we can make a good decision when we go to make our final votes. And I do trust my caucus members, but I also, you know, if you have any comments, especially if you've got my phone number, send me a text, because you know, I appreciate the input and the heads up on these bills, because I know one of the bills we were working on, just some hospital transparency bills. And when you go in to a meeting and you know nothing about these topics, and the information and the learning curve is extremely steep. And, you know, sometimes we're voting within 15 minutes of these topics that we know very little about. And we also don't get a lot of notification as to what bills that chair is going to decide to hear. So things move very quickly, and it's good to have. I love that I have so many experts on my my phone. I know I was texting Eric Grossman during Ways and Means on all these assessment bills. It's like, read this bill. What does this mean? And, you know, and he'd explain it to me, and it was great. And, you know, and of course, Susan got some messages from me, and many other people, or even our mayors. I will reach out to them. Is this something we want? Is this something we don't want? You know, are you aware that this bill is going on? Purdue. So I'll go back to 1405, where 51 ended up. And I don't have all of the bills that ended up in that bill, but one of the things that happens in conference committee is that's your last chance to get a bill through that has died. And there were a lot of them. So 14 bills, I believe, ended up in this one bill, which was House Bill 1405. And it had to do with long-term insurance, long-term care insurance. Great bill, simple bill, offered people an opportunity to get, long-term health insurance, long-term healthcare insurance. So, if you end up in a nursing home, you're covered, because nursing homes are extremely expensive. So this simple bill had everything. 51 ended up there. The vaccine passport bill, which I was very concerned about. And I had our lawyer look at it. We had everybody look at it. And again, this writing of bills, because this is a big issue, like putting abortion everywhere, this vaccine passport was a big issue. And, it made the news. Is like, oh, you can't make me get a vaccine passport. So what this bill says is that your local unit of government may not create or mandate a vaccine passport. And a vaccine passport can basically be, the little card that we got when we got our vaccines that, pretty much say that we have gotten our vaccines. It can't be created electronically or digital, in any form. But the issue is, there isn't going to be any local unit that says absolutely everybody in this community must have a vaccine. That's unrealistic. So, and they're also not the ones creating them, because we're getting them from, where we're getting our vaccination. So basically it's, a bill that appeases a base by saying, yeah, we passed this bill that prevents vaccine passports, which is just a completely made up thing that has, come into the media to scare people. But it's a fairly useless bill, because it's unrealistic. And, it's just, it's not going to happen. So, is technically a resource to monitor vaccine port. It doesn't, they can
do it.
What's that?
No, I was just commenting that is ridiculous. Like, our local health departments are not equipped they're not technically equipped, period, for the most part. They're not up to security code. They're not up to data standards. They're like, they would never even be able to think about using a vaccine passport. So.
Yeah, well, and that's the thing though. It's like, it's saying that a local government, like the city of West Lafayette, cannot demand everybody in the entire city be vaccinated. It's like, that's just not realistic, and that's basically what this bill says. It's like, you can't come within city limits unless you have a vaccine, but that doesn't prevent a private owner from requiring a vaccine. One of my concerns, which I brought to Purdue's attention, was, it's like, is this going to affect what they were doing? Because I know they had been talking about whether or not they would require vaccines before students returned. And I thought that would be a really big deal. So they had their lawyers look at it, and they got back to me and they said they were fine with it. They didn't think that it was going to be an issue. So, so again, it's just, it is what it is. But I know one of the questions that was asked also was about summer study committees and which ones we should watch. I kind of looked through the list, and one of the ones that concerns me is the charter school funding and methods of improving school building utilization panel. That one I'm very concerned about. Yeah, they're constantly trying to figure out how to get our public buildings away and for charter use. One of the good news is that I'm not sure if it went through, but there was a bill that had to do with evaluating some of our charter schools. And I know we do have a lot of charter schools that are closing across the state because, they're not making as much money as they hoped. And, a lot of them are just not doing well. And then I wasn't sure if there was already an electric vehicle product commission on the list from prior years. But as far as the list of the summer study committees, they look like they were mostly commissions that were probably already, I didn't see a lot that looked like they could be new. But I basically asked to continue to be on the Medicaid Advisory Committee. At one point we did, we had asked, we had amendments on a lot of the commissions because they didn't always include a Democrat. Sometimes they would have just one appointment from the General Assembly from the House and Senate, which means there will most likely be just a Republican. So we were oftentimes trying to make sure that there was either even representation or equivalent to, maybe the breakup of the parties represented, but at least a Democrat representative on commission. So there was a Native American Indian Affairs Commission, which went through through government and regulatory reform, which I'm the ranking member. And I was asked to add an amendment to have a Democrat added to the commission. And it passed. I was completely shocked. It's like, yay. So I actually asked to be on it since, it's one of my wins. So, and I assume that it's going to be gaming. So that should be interesting. Yeah, I also asked to be on services for individuals with intellectual and other developmental disabilities task force, and the Indiana Commission for Women, which I believe they were trying to get rid of it, and I'm not sure it got funded either. So, but I did ask to be on it. To watch charter school funding surprise. Yes. Yeah. Yeah. They're not surprised either. It's like there's not a whole lot on the list. It's mostly just committees that State Fair Advisory Committee, the Commission for Social Status of Black Males, Public Defender Commission, they all just kind of look like commissions that are already probably have been in place. And they're committees that I think a lot of times don't meet or only meet if there's an issue. So I don't know that there's going to be anything terribly pressing, but I'll definitely keep my eye on anything that looks like might be. And I could probably send this to Chris if you want to look through the list and see if that looks like.
That'd be great.
Yeah.
Always love to look through a list.
Yeah. So any questions? Redistricting, I didn't get to. Redistricting, we're just waiting. I did see that right now they're expecting the census to be done. I think we had put that down. I think the end of July. They're predicting we will meet sometime in the fall. They're not sure when to look over the maps. I seriously doubt we'll have any input whatsoever. It was a very interesting session considering the Republican caucuses were fighting. Their caucuses, they were meeting twice as long as we were because they were just divided and fighting over issues. So it was interesting. And of course you saw, they're fighting with the governor, they're fighting with each other. I'm just wondering what's going to happen when there's more than 71 of them. And, it's like, you just want them to kind of self-implode and,
Right. That was kind of an interesting thing this session because there were several bills, and I'm sure you noticed this, out of our priorities, a lot of times, it was you taking the right votes and then Senator Alting, Republican District 22,
Yeah,
also taking some better votes on a lot of the bills this session, including it's kind of not much of a secret that a lot of the reason that we don't have a lot of the anti-trans bills that we have in a lot of Indiana triplex states is because of the Indiana ACLU and their advocacy, the advocacy of a lot of trans people from across the state, and because of people like Senator Alting who are keeping those bills from getting into committee. But yeah, there's been a lot of times this session where it's been really strange to watch because we've had bills even like 389, 389, the wetlands bill, where the Republicans suddenly go into caucus and we don't know what's going to happen, and we're not sure if they do either. So
yeah. Well, we were hoping we had enough votes to kill it, but
right,
I noticed that we usually we would get about 10 Republicans to sometimes join us, but
right,
yeah. But even overturning the veto the other day, which Senator Alting, that was his bill, the taking away local health departments' control for medical, health emergency crises. Um, uh, the only two Republicans voted, against overturning the veto, um, and I don't think there were any in the Senate.
yeah. I saw the sheet for that. I think a couple of days ago, and that was a really really disappointing vote and a really disappointing bill as well.
Yeah.
I
Well,
did
and
have
I wondered if that's why the governor didn't veto the one that took away his power, because he was relying on that one, because everything that the local health department does is coming out of the state. I mean, they're taking a lot of the recommendations from the state, because I know when we would when I would contact the health department, there's like, well, this is what the state told us to do, so
Yeah, there's continuing questions about, the relationship between the executive branch of government and what the governor can do during a state of emergency and what the legislature apparently thinks needs to be done during the General Assembly.
well,
That
yeah.
intersection has been very strange to watch.
Well, and it's interesting because it took 3 months for the bill from start to finish to take away the governor's control. It's like, okay, so now during an emergency situation, you want it to go through the legislative process. That means going through, one house to the other house and then back, and it's like at minimum we're talking at least a few weeks. So this, and I, we do come from a wide range of diverse backgrounds, but I don't think the builders, interest and abilities, rank with an actual medical doctor's, opinion about what to do during a medical crisis. So
Right. That's a really good point to make because sometimes it's hard to deal with expertise, right? And to what extent people defer to real expertise on issues. So
yeah,
hopefully your colleagues get a little bit better about deference to expertise because it's been quite a problem.
they really are convinced they've got it figured out. So, and they let us know that we were they really didn't care what we had to offer. Especially this session, it was worse than the first 2 years that I was there.
That's good context to know, because I wouldn't necessarily say, from somebody who's only been watching for a few years, but still been watching for a few years for the General Assembly, I wouldn't necessarily say the situation was great, even in the past few years either. So
Yeah.
So the
Yeah.
idea that it could
Well,
possibly be
even legislators that had been there a long time, they said it had never been this bad. in the way that people treated each other, and just the how they handled the bills. In the past, they pretty much had, kind of an unsaid rule that on every bill you should have 2 Democrats and 2 Republicans. This year they filled the bill with all Republicans. They wouldn't even leave a spot for a Democrat on a bill. So,
Right.
and sometimes they, they were the bill of the Republican. Maybe they would be the token Democrat on the bill. But it's, in order to get things through, a lot of it's happening behind the scenes. I know I was working hard on the telemedicine bill, but, Senator Charbonneau really wouldn't budge when it came to the telehealth bill, which is probably going to make it difficult in the future, especially when, we're training, in my profession, speech language pathologists or audiologists, if they get to the point where they're pretty much working at an independent level, but they haven't completed their doctorate or their master's degree where they're licensed to work, but it's that last level where you're doing that clinical work where you're working independently, basically as a medical student, but you're not licensed yet, and if they're supposed to be able to do the same duties in the same way as a person who's licensed, there's some restrictions there. So I think that the way we do things has changed a lot. And I think we've learned how to do things in very, productive ways that, we could have been moving in the direction of that we just, which was kind of forced through the pandemic. But, I think we still have some work to do before we get to that level. But I am concerned moving forward if we, there's some restrictions that were created that, people were able to do it because we didn't have anything in language preventing them. But now we have Indiana code that actually is going to prevent some things from happening. So it should be interesting going forward. I know one of the bills that we're kind of at the last minute here. One of the bills that I was very concerned about, and there was some division, and it had to do with public notifications. And it was Senate Bill 332. It wasn't, an exciting bill, but it was controversial because we rely on public notifications to be in newspapers and, to be transparent. And we're getting away from that transparency. The bill that passed took away any second notifications or additional notifications from being required to be in a newspaper. It could go on any digital format that the local unit decides, without the public being able to know where that information is or how to access it. I tried to add that it couldn't be on social media because not everybody's on Facebook, or knows how to get on Facebook or knows where their Facebook page is. In addition to the fact that, just creating a website, there's a lot of places in the World Wide Web you can put a website. So I'm concerned moving forward about, we have new technologies, but it's making it easier for things to be less transparent.
That's a really good point. Just broadly about how transparency might not be valued as much anymore, or we're not really seeing that because if you look at the legislative history of some of the transparency laws in our country, they really start to come up in the 60s, 70s, and to some extent in the 80s, and when people really started seeing that was really important, right? So seeing those laws kind of get weakened is kind of distressing. If you have anything else, do you have anything else for us? Because I
Oh,
have just
no, I'm
one.
just like, gotta
All
just
right.
stop me because I'll just keep going.
Ooh, well,
One
first I want to
question
thank you a lot. Does anybody else have any questions for Chris?
Oh,
Sorry.
just one thing for actually us to help you. I know you touched on, summer committees and whatever. Are there any areas of experts or expertise that would help you get introductions or information that you anticipate in the next
Well,
next year?
Susan, you know that I rely heavily on you because, there's just so much information when it comes to Medicaid, and it's just there's just it's a very technical field, and it's, I think, anywhere, especially in the health field. I know we had this bill on making cost in hospitals more transparent, and I tell you, it's like if I had to vote on that bill, I was so confused, and luckily we had all week to go over it. And of course, that's not the bill that went through, but it's like, but just the learning curve in some of these areas can be very technical. So I really appreciate that, the fact that we have such an educated community and I'm able to reach out. And I know that I've had a lot of people offer their expertise to me, but I don't always know what bills are going to come before me. And for me, it's most likely going to be in the committees that I'm on, and those are the committees that my co-caucus members rely on me to understand. And luckily, there's I'm not even the ranking member on insurance and financial institutions, so I really respect Terry Austin, and she really helped me work through the bill that they put 15 bills on, because that was pretty overwhelming. So but anyway.
Great. Thanks for that. Does anybody else have any questions? All right, I'm not seeing anything else, so I'm just going to drop into screen sharing really quick because we have one
Okay.
more thing. I dropped it in the chat for you all. It's a link to an advocacy form, which is like my new middle name. We're using advocacy forms to frame messaging to elected officials over the interim between sessions, right? So the idea of this first advocacy form is that we're going to be advocating for something that's very familiar to us. It's something that we've supported as an organization since 2017, and that is voting by mail. We're really fortunate in Indiana to have a really active vote by mail organization that is agitating for vote by mail across the state. So we just wanted to help them out a little bit, help out the movement toward easing access to the vote, and then make sure that our electeds are hearing this issue. Something that Chris mentioned and that I've heard a lot from other elected officials is that a lot of times they don't get a lot of the messages about increasing access to the vote. A lot of times they're going to hear messages that are kind of about, oh, like let's prevent voter fraud, which a lot of times is sort of a like a code word for let's enact voting restrictions, right? So even if we do have ideologically people who are ideologically disinclined toward voting, and by that I mean a vast majority of Republicans, they still need to hear this type of messaging. They need to know that there are people who are out there who want this from them, who want to see expansion of voting systems and a type of vote by mail system that works in a lot of other states, and that we're going to continue to do that. So if y'all could just fill out the form before you go, I'd really appreciate it. I don't actually even think I need to screen share this, but I will anyway because I spent a couple minutes on it. Here we are. I'll just share it like this because I'm having some difficulty with my thing right now. But yeah, you can use the messaging to write an email to urge your state representative to support vote by mail. One of the cool things about the system that we use now is that when you're writing messages through Fast Action or Every Action, it routes it automatically, right? So it will send an email that's from your email address and that is formatted so that it's like an email that you wrote completely by yourself. But fortunately, we can also do things like customize messages and things like that. So I'm going to stop sharing right now because I'm basically done. But yeah, I also wanted to remind everybody that next month on June 5th, we will be having the Persistence Picnic. This is going to launch some of our voter registration programs for the summer, and it's going to be a really great time. We're meeting at Columbian Park in the Blue Shelter, I forget which one. We're meeting at Columbian Park, and from noon to 3, we're going to have snacks, we're going to have drinks, we're going to have some music and some games, and we're going to have some information about ways that we can get involved in voter registration over the summer. As you may have heard from us before, we do have a bit of a gap. We really want to make sure that we get maybe about 3,000 or 4,000 more people registered to vote over this next couple of years before the next election. And that's kind of a heavy lift, right? So we know that we can't do this work alone. So we have more information about the Persistence Picnic up on our Facebook page, and I believe up on our website as well. So I really encourage you to take a look at those things and commit to show up. It's going to be a cool, chill time. We're not going to overthink this one. You know, this is you show up, you sign up to register some voters, we eat some pastries, we drink some drinks. It's going to be a good time. Thanks to everybody for coming out tonight. Does anybody else have anything else to add before we wrap this one up? We all good? All right. And if you haven't already, has everybody signed in? Did everybody use the sign-in sheet to sign in? I'm seeing one no from Anne. Hang on just a second. We'll drop that in the chat for you again.
I was here.
And all right. And Michelle put this in the chat. We are meeting at Blue Shelter 4 for the Persistence Picnic. Thanks for that. And I just put the sign-in sheet in the chat, so if you could see that. And one thing that we put in the sign-in sheet, pardon me, for those of you who aren't already, we organize by Slack, which is a group messaging application. So if anybody needs access to our Slack channel, that's just basically where we gather, exchange information, have our discussions, and it's also where we put our events kind of first. So it's a good place to sort of get in touch. And if you need access, you can just request it in the form. We'll send you an invitation. And before you know it, you'll be hanging out with us every day. All right, so thank you all so much for coming again. And if you're watching this online on YouTube later, remember to smash that like button and hit the bell to subscribe. All right, thank you all so much. I hope you all have a great night.
Good night. Thanks.
Thanks, Chris. Thanks,
So much.
Chris, both Chris's.